name is Osafo Fraser. I'm a family physician and a public health practitioner out of Trinidad and Tobago. Well, Trinidad and Tobago is one of the Caribbean islands, and we have had a very successful management of COVID-19 thus far. And if you are even remotely aware of what's going on in the Caribbean, a lot of the Caribbean islands have very low cases, and the Trinidad is no different. I think we have just over 120 cases at this time. And fortunately for us, all of our cases have been cases that have been imported, and we have no established community spread at all. So that is really, really very good news. We've only had a handful of people that have got very, very ill, and a few of those have actually died. But I think in the main, those who got ill have recovered very well and have gone on to just be reintegrated back into the society. So as a clinical or a medical impact, it has not been very, very, very severe at all. Having said that, though, it is not the same story for the way it has impacted the rest of the society, because in an effort to mitigate the spread in Trinidad and Tobago, we did what a lot of the world did, which was enact a shutdown, so to speak. And a lot of the small businesses, sole proprietors, the man in the street, so to speak, those people felt the brunt of the shutdown. People stayed home, not being able to come out and buy things. And so there's that double-edged sword, so to speak, of what happened because of the COVID-19 in this part of the world. Trinidad has been very fortunate in that we were able to get PPE stocked at the right time, and also be able to enact the policies that allow us to use the PPE in the most efficient way. Because PPE, the challenge with PPE is not just availability, but it's also the way in which you use that which is available. And I think we were able to hit those two things at the right time. We got the PPE just before all of the PPE stocks worldwide went down. And so we were able to stock up. And because we did not have a lot of cases very early in the epidemic, that helped us to be able to still have PPE when our cases really started coming. Once we had the PPE stocked, we were able to then decide, let's use the PPE in this kind of way. So put it in a policy fairly early to mitigate against excess use of PPE, which is a big, big challenge. And obviously, excess use of PPE in many cases was connected to the fact that the virus kept changing on us. One moment it was not airborne, and so we could use a certain level of PPE. The next minute it was airborne. One moment you could not get it from people who were asymptomatic. Before you know it, asymptomatic people were carrying and spreading the disease. So the use of PPE kept scaling because of the knowledge about the disease. But a lot of times we had inefficient use of PPE because people were a little bit unsure of what level to wear for what particular situation. Eventually, I think we got it right. And so we actually do not have a shortage of PPE for medical professionals in the public system in Trinidad and Tobago. I think early in the game, some of the private facilities had a challenge because they were acquiring their stock from the retailers in Trinidad, but everyone was also running to buy the same PPE, running to buy a mask, and so on. This is John Public. And so some of the private physicians did complain that we had no masks available for us to buy because the public had gone out and purchased the same. But I think in the public system, we were in a fairly good place, and we still are in a very good place. We still have to do a lot of actual scientific research to figure out things like, did the virus behave differently here? was it not as virulent as other places? But my sense is, given what I've seen, it's a combination of all of those things you mentioned there. One, it was the fact that we closed our borders fairly quickly from countries in the initial instance that had high levels of infection. And then eventually we closed it altogether to the entire world. We instituted very early the quarantining process. And then we also quarantined everyone who was isolated, everyone who was found positive, which is a big deal. You know, we had the capacity, fortunately, to isolate in a state-run facility every single person who was positive. So you were not told to go home and self-isolate. You were taken to the facility and you were treated there until you were found to be negative by the standards that we judge negative to be by, and then you were sent home. So that really helped the spread from people who themselves were positive. But I have seen, you know, because part of my job in public health was participating in the contact tracing of positive individuals. And I have had a number of individuals who were positive. They lived with close relatives, interacted with them, and none of those relatives or close contacts became positive. So I do think the virus behaved a little differently here than it did in other places. And the why that is anybody's guess. But obviously speculation about the weather and the possibility of the virus changing a little bit when it got here. Those kinds of conclusions is kind of hard to reach now because we still kind of do the research. But I would say there definitely seemed to be a little change in the way in which the virus spread, even among those who became positive. The contact tracing, well, we didn't use any apps. We used the good old-fashioned telephone call interview. It was just that. Trinidad is divided into 9 counties, and each county has a central county medical office. And so whenever a case was discovered in a county, that particular county office was responsible for contact tracing that case. And the contact tracing would be many people on telephones talking to the primary contacts. That would be the person who will directly in contact with the positive case. And then we contact trace the secondary contacts, those in contact with the contact. And then we contact trace the tertiary contact. So we went 3 levels out and quarantined all those people. So the quarantine process was very extensive. I remember there was a particular case whose contacts, when we had got to the tertiary contacts, had over 300 contacts who had to be quarantined. And that was the extent of which the quarantining process went. We had to quarantine everybody who came into contact all the way to tertiary contacts. It was not pleasant for many people. Many people did not want to be told that you were in contact with somebody else who might have been positive, because it meant you had to be home for 14 days. It was difficult for the employers to be losing people who had to be home for 14 days. And some of the employers were not very happy that we were taking so many of the employees away from work at the time. Some people were scared when they were told that you were in contact with someone else. And it did not matter how many times you told them this is just out of an abundance of caution, they were still scared. A lot of the contact tracing we did was counseling and trying to allay people's fears and make them reassured and track them every day to make sure that they never got any symptoms and never got ill. The minute somebody did get sick or develop symptoms, we then enacted the next part of the process, which was getting them to some center where they can be tested, just to make sure that they were not COVID positive. So that was the contact tracing process. And today, it still remains the same. We obviously are not contact tracing anymore in the same way because we don't have community spread. But the system of tracking people, making sure people remain well, people who come back into the country and are in quarantine, that system is still continuing in a different kind of way. In Trinidad, I would say we did have a fall off in the initial part of people coming out to be seen in the private setting. But there were two reasons for that. One was the country was on lockdown. And so you were not going to come out unless you were gravely ill. And so people stayed home for things that they would have taken the liberty to come out for before they made the adjustments at home and managed those things. And the second reason, I think, was the fact that the whole situation of uncertainty played a role in people's, I'm not sure if I go into a medical establishment, I'm going to end up catching this thing. And so I think that was the initial response. But since, and again, the knowledge of the lack of community spread has played a big part in people's behavior. And when we started to reopen the country, people were feeling very comfortable to come out and to seek care. At the initial stages, some of the private institutions were turning away persons who presented with symptoms suggestive of COVID-19. And they were sending those people to the public system because they were not either not equipped or not willing to deal with those COVID-19 cases. I personally did not have a big fallout in the family practice at all, really. And people continue to come on a regular basis. But I think in the main, healthcare did not suffer as much as many of the other businesses did in Trinidad and Tobago. There's a wonderful place to telemedicine now, not just in the future. And I think that people once it takes off in Trinidad, and because of COVID-19, a lot of institutions started to experiment with telemedicine and with how it could work. And so there's great potential for it here. I know a number of people in Trinidad have actually started that service, and it's welcome. If it will ever replace coming to a doctor's office completely, I don't think so yet. I don't think we're there yet. Some things still require you to put your hand and to touch and to examine, and still require a little bit more testing. But there is a great place for telemedicine. I think since the scenario of COVID-19, that option has become more available to people than it would have been before. In the main, the government has taken the position of informing the population about the local scenario. This is what is going on here. And these are the things you should do to protect yourself. Very simple messages. All the prevention methods that have now become part of our lives. Wearing facial covering, washing your hands, sanitizing, coughing into your elbow. So that has been the message that has been drummed into the population from the very beginning. The more detailed pieces of information that are out there, those things have not been communicated to the public from the government side. That is something that has been really left to the population to delve into. But the basics of this is the scenario locally with some global context. This is what you do to protect yourselves and your family and your neighbors and your loved ones. That has been the constant message. And so people were left to go and do all of the research. I kept saying that everyone was an expert in COVID-19, right? The average man in the street knew everything because everything that was done was made public. All of the research was public online, even now, and free. Every person could talk with a level of confidence about COVID-19 because the world learned about COVID-19 together at the same time. And so information was readily available. So the government didn't push that side of it, but it certainly pushed. Certainly what was pushed from the government side was prevention. As far as research is concerned, I personally, if there was a a research I would want to be involved in will certainly be connected to things like the way in which the virus behaved locally, and why it behaved the way it did. Is it a different virus here than it was somewhere else? What are the factors that make the virus do what it did here? And is it something that we can reproduce? I would be very interested in that. But I think the bigger question about research and unlimited funds, if I had something like that, would be, for me, I would want to make sure that it's put into trying to find a vaccine and trying to find some useful treatment, because I think that's where the thing has to go, right? Ultimately, until we get a vaccine, it's us trying to manage in different ways, and a vaccine and a test, a proper rapid test that is stable, that is acknowledged and approved by all of the major agencies. That's where I really want to put a lot of the funding. Let's get something that works. Let's get treatment for people who, if for some reason did not get the vaccine and got sick, can be treated and can be treated well in a predictable manner. Let's do that so that we don't have people dying that don't need to die. And let's get a rapid test that I can test very quickly to see if I have it and then what to do, or if I have had it and a test that's reliable. That will save a lot of issues with travel and movement and work and locking down of economies and so on. So those three things, testing, treatment, and vaccination, would be where I want to throw a lot of the funding. Trinidad started testing, and we are still testing in the main using the Caribbean Public Health Agency lab, which is CARPHA. And the CARPHA's policy was nasopharyngeal swabbing. And the science behind it obviously is well known, that nasopharyngeal and oropharyngeal swabs, those are the ones that give you the highest yield of the virus in the very early part of the infection, which is where you want to catch it. And so if you have not unlimited resources, you want to put your resource into the place where you get the greatest amount of virus and the greatest possibility of a good test. So we use nasopharyngeal swabbing. Locally, we started advertising that we'll be testing people. Come to these centers, come and test. Once you have symptoms, come and test. And the people just would not come. And even if they came with symptoms, many of them refused to be tested. Some of the refusals were connected to the fact that the test was just not comfortable. So we need a better test. I think, again, let me speak for this context, right? Trinidad and Tobago. And it extends a little bit, I think, to the Caribbean in the main. It is a little different, I think, for places that have established community spread like Europe or North America. But in our context, we have a wonderful opportunity to get it right now. The vaccine is still a long way away. I think at least another year, WHO has said, and some of the other authorities. I know people are working very hard. But until we get a vaccine for sure that works, everyone has to practice social distancing. Everyone has to figure out the facial mask wearing. Everybody has to work out the sanitizing part of it. And those things have to become habits. And I think now in Trinidad and Tobago, we have the opportunity to develop those habits. Now, when we do not have the onslaught of the virus in our faces, is the opportunity to develop those habits. And that's the message that's been pushed from the Ministry of Health and the government of Trinidad and Tobago, which is do the needful. Put things in place in your own personal home. Make sure that your home, you're practicing these attributes. Don't leave home without a mask. Businesses have been given guidelines as to what to do to make sure that your business place is set up in such a way to prevent the spread of COVID-19. Use those guidelines, put them into place. And those guidelines extend all the way to religious organizations, to schools, to small and large businesses. Follow the guidelines, make use of it. Let the practice begin now, so that if we do get a surge in the future, we would have the added barrier of doing all of the safe practices. If I had to say something to the public, it would be that. And I think the temptation here is to be lax because we don't have community spread and we don't have a lot of cases. And I think that could be a very dangerous thing for us, which brings me to what I am a little concerned about when we open the borders, because that will be the issue. The issue will be, how do we manage the cases that we will get when we open the borders? And part of mitigating that is just having a general culture already established of safe practice. I think our health system is in a good place to be able to deal with cases that are coming. But having said that, I think it's important that every citizen does his or her part to make sure that as a nation, we have a safety net around us through just how we as a culture live. I don't know when our borders are going to be opened. I suspect it's going to be in the very near future. But when it does, and we have not yet heard what the plan will be when the borders are opened, if they will be quarantined, if people will have to stay home when they come back for 14 days, that has not yet been said. But whatever the thing that's going to come, eventually, the country has to reopen for business. People will have to come back. And I can be sure that tourists don't want to have to come and stay locked up for 14 days before they start to have fun, right? So whatever happens, there needs to be a strategy put in place to mitigate the spread of when people start to move around. And so my concern is that right now, our lack of community spread could be a false sense of security and not do for us what it really is supposed to do, which is prepare us to form the right habits.